So lung cancer screening is something we expect to be implemented in Europe within the next few years. And what we aim with lung cancer screening is to reduce lung cancer mortality by detecting tiny nodules which are early stages of lung cancer. And these early stages you can easily treat and you can heal, in contrast to more advanced stages of lung cancer. There's still a number of questions open. What has been shown in a number of studies is that lung cancer screening works. We can reduce lung cancer mortality. However, there are a number of details where AI could help us, and in particular in the management of these tiny nodules, because these tiny nodules are common, and most of these nodules we detect in our CT scans are benign. And now there comes the problem that you don't want to harm patients, or persons in that case, by investigating them with invasive measures or whatsoever. Where AI can help us is to predict the probability that we are dealing here with lung cancer. We know that size is an important factor. The smaller the tumor, the lower the likelihood of malignancy. But we can get more information out of these nodules, and this is what we expect to see in the near future, that besides the size of nodules, we get more information from an analysis of the texture of nodules, the configuration and so forth. By doing that, you can limit the number of persons who need to be investigated further. This would then reduce costs, but then also reduce harms for patients. The problem with false positives and false negatives is something we are confronted with every single day, with every single protocol, with every single procedure we are doing. So that's something we know. With AI, we expect both to get better, so to reduce the false negatives and to decrease the false positives. We benchmark this with our conventional methods, primarily volumetric measurements of nodules. So we do have tools at our hands to benchmark these softwares before implementing them. So I don't see much of a risk here. I mentioned that AI will help us to first identify nodules and then also classify nodules. But then for nodules with an indeterminate risk, meaning you do not know if it's malignant or benign, so a risk in between, we perform follow-up scans. And for these follow-up scans, what we do is we estimate or we measure the growth of these nodules. And also here, that's difficult to do if you just have your digital caliper, because we are not really precise. That's within the method. But with volumetric analysis of nodules, we are able to do that much more precisely. And this is what most of the guidelines, in particular the European guidelines, now require, that we have this volumetric assessment, which shows the change of volume over time. And also here, the software is something we need.